Hi friends, welcome to classes by Lab Doctor. In today's class, let us see about the crystals which we can see in alkaline urine or urine with high pH. In the last class, we have seen the crystals which we see in acidic pH. So, alkaline pH crystals are your amorphous phosphates, triple phosphate, calcium carbonate, and ammonium biurate. Calcium phosphate also is seen in alkaline pH. So one thing you can remember, if you compare these crystals which are seen in acidic as well as alkaline, remember all the crystals which are seen in alkaline pH are mostly the one which are associated with urinary tract infections, etc. So whenever there is an urinary tract infection, there is a lot of urease, there is a lot of ammonia, there is bicarbonates, etc. So hence this triple phosphate, yeah, amorphous phosphates, same with ammonium biurate. So all this will increase the pH of the urine and you will see such crystals. Calcium oxalate is the only one which is seen in acidic urine. Calcium carbonate, yeah, calcium phosphate, they are seen in the alkaline urine. So mostly the phosphate thing, amorphous phosphate, triple phosphate, calcium phosphates are seen in the urine with alkaline pH. So this is a very easy way to just remember, so that whenever you see a crystals, because what happens is sometimes some crystals look similar, so it is different, it is difficult sometimes to classify whether this is calcium carbonate or this is calcium oxalate or this is calcium phosphate, etc. But the urinary pH plays a very important role. So if you are seeing any crystal and if you're seeing that in a particular pH, you will be able to correlate better. So triple phosphate crystals, so this is the most common kind of crystals which we see in alkaline pH, and these crystals are formed by crystallization of ammonium magnesium phosphate, and this is because of the urease producing bacteria. So these are the crystals, this is very commonly we see in urine, and these are like this prismatic coffin lid shaped crystals what you see. So this will be, you know, like a coffin lid shaped, and they are sometimes they are prismatic in nature also. So I've told you that this occurs in alkaline urine. So how the urine becomes alkaline? The urease which is present in bacteria, it will split the urea and release ammonia, and from here we get the bicarbonate, and this bicarbonate is the one which will increase the pH of the urine, and that helps in the formation of these crystals. So this also forms, when these crystals will come together, they will form the stones that is called as a struite stone, and it is made up of magnesium ammonium phosphate. So it is not triple phosphate, actually it is magnesium and ammonium phosphate and calcium phosphate together. When they come together, they form such kind of stones. So whenever this you can see these crystals here also in the in the urine, this they can be seen singly or they can be seen in clusters, but mostly they have this characteristic coffin lid or this prismatic appearance. So this is a stone which is again formed whenever there is a urinary tract infection, etc. And whenever you see such stones, you will have to remove the stones completely, because to control the infection, otherwise they can damage the urinary tract. These are radio opaque stones, and these are formed by urease producing bacteria like Proteus, Pseudomonas, Klebsiella, Staphylococci, but E. coli will not form these stones because it is not urease splitting. And these are the triple phosphate crystals in the urine. See, this is a coffin lid, and this looks something like this. So the crystals look something like a coffin lid, and they can also be like this prismatic in shape. So this is the most common form which we see, and these are triple phosphate crystals, magnesium ammonium phosphate crystals. And remember, they are found in the bacteria whenever there is bacteriuria, and they raise the urinary pH. So next category is amorphous phosphate. So these amorphous phosphate, I've told you, they don't have a particular shape. They are something like granules. They don't have a typical shape as we saw in case of the triple phosphate crystals, etc. they are more granular, and when you refrigerate this urine, if you see the sediment, it will be whitish in color. They are soluble yeah, whenever you add acetic acid to it. These are soluble, unlike amorphous urates. They are not soluble in acetic acid. So how do we differentiate amorphous urate from amorphous phosphate? I've told you, see the sediment. If you see the sediment here, the amorphous urates, they will be brick dust appearance, or they will be reddish brown in color. This is whitish in color. Both are amorphous. This is seen in acidic urine, this is seen in alkaline urine. Phosphate, so there, here also this is seen during urinary tract infection, etc., whenever the pH is raised. So this is how we differentiate from amorphous urate and amorphous phosphate. Next is calcium carbonate crystals. Carbonate crystals, they do not have much of a clinical significance, but what happens is sometimes these dumbbell shaped structures, etc., you might mistaken this for calcium oxalate or other stones, but the pH of the urine will differentiate it. And these crystals, you will see that they are seen in triads, or they are seen in tetrads, and here also you can see such crystals here. So these are the other forms of this calcium carbonate crystals. They can be seen large circular crystals also with this radial striations. So these such crystals, when you see in alkaline urine, they, you have to think of calcium carbonate crystals. And also I've told you that these dumbbell shaped crystals which you can see, you can confuse this sometimes with other crystals, and sometimes you might even confuse this with the bacteria, etc., but then these will be birefringent, bacteria will not be birefringent. And also when you add hydrochloric acid or acetic acid, these crystals will effervescence, they form gas. So this is a characteristic feature of this calcium carbonate crystals. So these are very small crystals. They might be dumbbell shaped, or they can be spherical shaped with these striations. You add acetic acid, you add as hydrochloric acid, there is a gas formation, there is effervescence. They are birefringent, and that is why you can differentiate these crystals from bacteria, because sometimes they might look like a bacteria. They don't have much of a clinical significance. Next crystals would be calcium phosphate. So again, these crystals are also seen in alkaline urine. They are actually colorless kind of crystals, but they are needle shaped kind of a crystal. So if you are seeing some other needle shaped kind of crystals, try to see the colors. Try to see the what type of needles, try to see the pH. So these crystals are only seen in the alkaline pH. You would have also seen the uric acid crystals also, and some other abnormal crystals which are having this needle shaped, but they are all seen, majority of them are seen in the acidic urine. So alkaline, they are seen in the alkaline urine, and they are soluble in dilute acetic acid. So this is the calcium phosphate crystals. They appear as this wedge shaped crystal. So here they will be broad, here they will be narrow. So this is wedge. So this is wedge shaped crystals, and here you can see rectangular and a fan shaped. So this looks like a fan shaped crystals. So this is calcium phosphate crystals, and they are seen in alkaline urine. And next is ammonium biurate crystals. So these are the ammonium biurate crystals. So they are called as thorn apple. They look like a thorn apple because of the projections on them. So this is a thorn apple. They look something like this. ये इसके तरह दिखेंगे because of these projections. And ये alkaline urine में दिखेगा. So आप जब इसको एसिटिक एसिड ऐड कर दोगे, दिस बिकम सॉल्युबल, बट वही जब आप अमोनियम हाइड्रोक्साइड इसमें ऐड करोगे, दे आर नॉट soluble. So suppose if you see these ammonium biurate crystals in the urine, you should always ask for a fresh sample, because majority of the time sometimes the urine is not preserved properly. Urine बहुत देर के बाद analysis हुआ है, तो sometimes you can see such crystals. So if you are seeing such crystals, do not report it immediately. Ask for a fresh sample, and then you can reconfirm and you can report, because these ammonium biurate crystals, if they are found in fresh urine, अगर freshly passed urine में अगर we see ammonium biurate, then it is not normal, it is pathological. So in old urine you get it, that is quite a possibility. Ask for a fresh sample. So usually you will see this also along with the phosphates, because I've told you whenever there are these urea splitting organisms, they will form the ammonia. So there is ammonia in the urine, and that will increase the pH, so that will form phosphate crystals, that will form the biurate crystals. So these are usually associated with the urinary tract infection, and along with the phosphate crystal, triple phosphate, amorphous phosphates, etc. So because of the same mechanism how these crystals are formed, because all of them are due to this urea splitting bacteria, they increase the pH, they form the ammonia, they form bicarbonate, and then they will lead to the formation of such crystals. So they are opaque, sometimes yellowish in color, they have this irregular spicules, and these are seen in alkaline urine, and they are soluble in acetic acid. And if you are seeing such crystals in freshly passed urine, they are abnormal. So these are few of the crystals which you can see in alkaline urine. It is very easy to remember. So in alkaline pH, higher bicarbonate, higher ammonia. So you will get phosphates, you will get carbonates, you can get ammonium biurate. So amorphous phosphate, triple phosphate, calcium phosphate, you will get calcium carbonate and ammonium biurate. And secondly, most of them would be associated with urinary tract infection and urease producing bacteria, rising the pH of the urine. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.